Hey everyone, welcome back to our channel. Today, we're going to be talking about the differences between second and third generation contraceptives. If you're someone who is considering hormonal birth control, it's important to understand the differences between these two generations and which one might be best for you. What are contraceptives and how do they work? Before we dive into the differences between second and third generation contraceptives, let's quickly review what contraceptives are and how they work. Contraceptives are methods used to prevent pregnancy. Hormonal contraceptives contain synthetic hormones called progestins and/or estrogens that work by preventing ovulation, thickening cervical mucus, and thinning the lining of the uterus. What are second-generation contraceptives? Second-generation contraceptives contain a type of progestin called Levonorgestrel. This progestin is considered second generation because it was one of the first progestins used in birth control pills. Levonorgestrel is a relatively potent progestin and is used in combination with estrogen in most combined hormonal contraceptives, CHCs. CHCs are one of the most commonly used forms of hormonal contraception and include traditional birth control pills, as well as the contraceptive patch and vaginal ring. What are the potential side effects of second-generation contraceptives? Levonorgestrel is effective in preventing pregnancy, but it does have some potential side effects. For example, it may increase the risk of blood clots, particularly in women who smoke, are over the age of 35, or have a history of blood clots. Levonorgestrel can also have androgenic effects, which can cause side effects such as acne, unwanted hair growth, and changes in mood. What are third-generation contraceptives? Third-generation contraceptives, on the other hand, contain different types of progestin called desogestrel or gestidine. These progestins are considered third generation, because they were developed later than levonorgestrel. Desogestrel and gestidine are less androgenic, less likely to cause masculinizing effects, than levonorgestrel, and they have a lower risk of causing blood clots. They are also effective in preventing pregnancy and work in a similar way to levonorgestrel. What are the potential side effects of third-generation contraceptives? Like all hormonal contraceptives, third-generation contraceptives can also have potential side effects, but they are generally considered to have fewer risks than second-generation contraceptives. Some women may experience headaches, nausea, or changes in mood while using hormonal contraceptives. More serious side effects, such as blood clots or stroke, are rare but can occur. Examples of third-generation contraceptives. Some examples of third-generation contraceptives include some types of birth control pills and the hormonal intrauterine device, IUD. One example of a third-generation birth control pill is the Minipill, which contains only progestin and no estrogen. The hormonal IUD, on the other hand, is a small T-shaped device that is inserted into the uterus by a healthcare provider. It releases a steady dose of progestin, which thickens cervical mucus and prevents pregnancy. So, there you have it, the differences between second and third generation contracept.